Talking Joe podcast, minds in motion. Talk about relationships, help your emotions. Behavior management when your kids start to losing it. Talk about life and all the confusion. Minds in motion. Minds in motion. Talk about relationships. I'm talking Joe podcast, minds in motion. Talk about relationships, help your emotions. Behavior management when your kids start to losing it. Talk about life and all the confusion. Minds in motion. Minds in motion. Talk about relationships. Emotion. Minds in motion. Talk about relationships.
Hello and good evening, and welcome to Minds in Motion. I'm thinking we have some technical difficulties. I'm not sure if people can hear me. I want to say welcome to the viewers on Facebook, TDN TV, Facebook, TDN Radio and Caribbean, and YouTube, YouTube TDN. I also want to say welcome to the people listening to me and watching me on Twitch, and to the viewers on Instagram. This evening, I have a topic that is something that is very familiar to many people. It's a topic that affects many families across the diaspora, and I just wanted to just shed some light on the topic. If you can hear me, just let me know, because the audio is kind of giving problems tonight. If you can hear me, just give me a thumbs up in the chat. Give me a thumbs up from wherever you're watching, or to say I can hear you. So let's gonna continue with the topic tonight. The topic is Alzheimer's, and Alzheimer's, how it affects the Afro and Caribbean diaspora people. I wanted to just talk a little bit about that, and just some research that was released most recently, and just to have a dialogue back and forth about it and how it affects families. So this topic is one that can be devastating to families that experience dementia, or family members that are experiencing dementia and memory loss and Alzheimer's. And I thought to talk about it because it's something that is affecting my life at the moment, and memory loss. And I think that that's something that happens as people age. There's memory loss, there's confusion sometimes, and sometimes we don't know what to do. We don't know who to turn to ask for support. I see some viewers on. I'm just going to ask you if you can hear me. Just give me a thumbs up to let me know that you can hear the audio while we're on. Okay. So continuing with the topic of Alzheimer's. So most recently, within the last few years, it's been something that has been affecting my life, because I have a family member that is going through early memory loss, and it can be challenging because they don't necessarily remember when they've told you something, or sometimes they're going through the memory loss and they're not necessarily wanting to share with you readily that they've forgotten something, or they don't know how to do something, or don't remember in general. Okay. When I experienced that, when I started to experience this, I was like, nobody's going to believe me, because there's times when that person is lucid, when they understand and they know what's going on, and they're having great conversations and very cognitive conversations, right? Thank you for that. The number across the screen is for you to send in your text messages. If you want to text in a comment, the number is 1-647-495-3224 for those viewers who would like to send in a comment. And yes, please do like and subscribe to all of the platforms that you're watching on tonight. Again, you're watching us on TDN TV, and you're watching on Facebook. You're watching TDN Caribbean, TDN Radio Caribbean as well, and you're listening on TDN. We're also on YouTube, TDN, Twitch, and on Instagram. There are 2 radio stations that we're also live on, and those are GTM Radio and SBE Radio. Okay. So tonight I kind of just wanted to have a candid conversation. I am not an expert. I'm not a medical professional with this topic, but I just wanted to talk about my own experience and give some tips and supports about how to manage when you have someone that is going through early signs of dementia or memory loss, okay? And how it affects our community, right? Our community is a very unique community. And when I say our community, I'm referring to the African and Caribbean diasporic communities. And we oftentimes experience things differently from our white counterparts because of sometimes the way that we are introduced to things that we're dealing with through the medical system, right? So sometimes our diagnosis, they come to us slower because when we go to the doctor, sometimes we're not taken seriously, right? We're not taken seriously. Or sometimes we ourselves, we neglect things, right? We neglect going to the doctor. We are afraid to go to the doctor because of mistrust, or maybe just lack of knowledge. We don't go to the doctor for certain reasons, right? And through that, we have become a very susceptible to a lot of diagnoses that are affecting our community, all right? And Alzheimer's and dementia is something that we need to take seriously. We need to take seriously, and we need to take action. We need to know the steps to go about dealing with these topics, or this topic, I should say, right? So as I said, I'm not an expert on this topic, so I've decided I'm going to kind of research what the topic is and to give you some insight on it. And most recently, let me just look up. Most recently, in March, this March, yesterday, a matter of fact, yesterday, there was a conference, an Alzheimer's conference that took place, or it's taking place from yesterday onwards, so from the 17th of March onwards until the weekend. It's a conference on Alzheimer's and Parkinson's disease, and it's happening in Copenhagen, and Copenhagen, Denmark, and we have been already given information about the results of research about Alzheimer's, right? And I just wanted to get your insight, if you have any insight on this topic about Alzheimer's and if it's affected you or your family members and how you've been dealing with it. As I mentioned earlier, something that we need to really address. Once we know about it, we need to address it. So in my case, when I found out about a family member that is experiencing memory loss, um, I I brought this individual to the doctor. So the first stage, the first thing to do would be to bring this person to a medical professional, because there are signs that tell you that this person is experiencing memory loss or dementia, right? They might be losing things, they might be forgetting how to operate something as simple as a cell phone that they've had for years, or maybe even how to use the TV to change the channel. That's something that they constantly have to ask you about. Oh, how do you do this again? I can't remember how to use the TV remote, right? That's something that we may take for granted. People that don't have memory loss or dementia, we would take it as, you know what, that person, maybe they are having a medical issue. So if they have diabetes or if they have high blood pressure, sometimes memory loss can come in different ways, right? Memory loss can come from, even if someone has something that I've learned along the way, is that if someone has um, what is it called? A, a urine infection. A urine infection. If they have a urine infection, that can cause them to have some confusion and memory loss, right? And then through that, if that's temporary, then it's nothing to really worry about. But if you notice that this person is constantly being confused and disoriented, then you want to take them to a medical professional. If they're an older individual, if they're an older individual, so a senior, then you want to take them to see a geriatric doctor. All right, and when they go to the geriatric doctor, that doctor will diagnose for memory loss, for early memory loss, and can direct you to programs that you can take as well, but also direct you and support you in making decisions, lifelong decisions, or as decisions that are important for that individual. So eventually, that person's memory is going to go, whether it's short term memory or long term memory, that their memory, when it's gone, it's gone. So it's best to start taking action early. For example, if you wanted to sign up as POA, I don't know how it is in the Caribbean, if they do that in the Caribbean as well. POA is person of authority or responsibility. They're taking responsibility for the individual who is experiencing memory loss. And you are taking responsibility for things like finances, dealing with the bank with finances, property, so estate, just making medical decisions, right? Things like that. So you might be the one to step in to say, I want to support this individual. And you don't want to wait too long to the point where they don't even know what is going on and to make a decision, to even make a decision. Okay. So in doing that, in Ontario, Canada, I don't know for the Caribbean, as I said, in doing that in Canada, you can simply go online and get the application and you fill it out. So you want that person that you're signing for to be POA for to also be with it enough to understand what's happening. So you have a discussion with them and you say, you know, your memory is going. I don't know if you notice, but I want to be able to help you to make some decisions if things get really bad, right? Where their memory is gone. And POA is while the person is living. You can make decisions for them or with them. You can even make decisions for them, especially when dementia kicks in or Alzheimer's kicks in and they don't remember things like banking and estate information. Okay. So you would sign the document, and for me, in my situation, I had the medical professional who diagnosed the memory loss to sign it as a witness. So you need to have a witness to sign the document to say, they witness or they understand that the individual that is signing for POA understands that this is giving permission to you to make decisions for them. Okay. So once, just to talk about a death and how the POA works in a minute. For a minute, I'm just going to stay on this for a minute. How POA works with where death kicks in. If death happens and the individual passes away, POA is no longer a thing. It's no longer applicable for you and the individual. So the question is, what's the difference between dementia and Alzheimer's? So as I was saying, I'm not a medical professional, but what I think the difference is between dementia and Alzheimer's is that dementia is where it's early signs. So it's an earlier stage and it's not full-blown Alzheimer's where they're not remembering about things that they used to do, right? Or can do. Okay. I could look up a quick definition because this show is all about learning together. So it's more of a podcasty show. Like I'm going to be talking to you, looking up things, and we'll have a conversation. So thanks for that question. I'm going to actually look up what dementia is versus Alzheimer's. So dementia, hold on 1 minute. So dementia, according to I'm in the wrong thing. According to my information, dementia means this. So it is a mental decline. So decline in the ability such as memory, reasoning, and language, severe enough to interfere with daily life and causes physical brain damage. So, for example, if a person is living on their own and they have to take medication, right? They're supposed to take medication daily. So they're supposed to take their, let's say, diabetes medication at 9 o'clock in the morning. And they're supposed to take it at noon and again at bedtime. So 3 times a day. And they forget to take this medication. Like literally, it's going to affect their life. They forget to take the medication. And then, but you remind them about it and they say, oh yes, I forgot. Let me take it now. So it's just a decline in memory and reasoning and language, severe enough to affect your daily life. Okay. And Alzheimer's, or as people say, old-timers, really and truly doesn't really have to be with old because younger people could also have Alzheimer's disease. And Alzheimer's means that it's a more progressive and fatal neurodegenerative disorder. So it degenerates the brain, causing the brain cells to shrink and to die, to literally die, leading to the most common form of dementia. Okay, so the brain cells actually die and they no longer remember things that they used to do. So that's what that is. Okay. It causes gradual decline in memory, thinking, behavior, and social skills. While irreversible, treatments can temporarily manage symptoms and slow progression. So, for example, let's just say, let's use behavior for example. Someone that has Alzheimer's sometimes can become very aggressive when you are trying to explain to them that they forgot to turn off the stove. Let's just use that for an example. They were supposed to turn off the stove and they forgot to turn off the stove while they were cooking. And you're telling them, hey, mom, dad, cousin, whoever it is, you forgot to take off the stove today and you could have burned down the house. And then they begin to say, no, I did. What are you telling me? I turned it off. And you know for a fact that they didn't turn it off because the fire alarm's going off, or maybe a fire truck had to come because of the fire alarm that went off, but they're still saying no. And they're getting aggressive and they're almost argumentative with you and want to be they want to be right, but they're wrong. And their memory, they can't remember. And it's not that they're telling lies, it's just they can't remember. Okay. And over time, it becomes more progressive. And this is where the Alzheimer's kicks in. So Alzheimer's is when the brain cells are dead totally, and dementia is when they're going through the early signs. So talks a lot about that. As I was saying, so when you know that your individual, your person that you're interacting with is losing their memory, sometimes in the Caribbean, we tend to want to say, that person's crazy, or you're mad, and we have to try to avoid those words because they're not good. They're not good. They're words that are going to be offensive, or that person will take offense to those words. And we want to avoid using those words and actually get the proper terminology. So dementia, early memory loss, or Alzheimer's, right? So as it said, it can be treated. It can be treated. And it is not 100% irreversible. So how can it be treated? Let's just say, if we go to the doctor and we say, okay, I have memory loss, how can we treat this? So there's natural ways of treating things with, I don't know if you've ever heard of ginkgo. I think it's called ginkgo biloba. And then there's different activities that you can do to keep your brain stimulation and memory going by playing games like card games, or even listening to certain music, continuing to do the same things that you used to do when you were younger. And I'm referring more to, in this case, of older people. So if you were an active person and you retired, the best thing for you would be to join a club, take on an activity, take up something that you used to do. So for your job, if for example, you were someone that was filing papers in an office, you might want to take up a job, or a volunteer opportunity where you're helping people in an office, right? Older people can do volunteer, right? You see these people all the time at Walmart volunteering, right? We're just focusing on seniors. People are volunteering at Walmart. They volunteer at the seniors' homes, right? Just keep yourself active. Be social. I think that's the main key, is to be social, because when you stop being social, you stop interacting with people, and you're by yourself a lot. You're not interacting. You don't know the date. You're not going outside. So you don't know the day of the week, and you don't know the date. Those things can really play into effect and have a great effect on people that are having memory loss, right? Because when you ask them what day it is, they may not know the day because they're not going outside every day. And that actually doesn't really it's not always dementia or always Alzheimer's when the person doesn't know those things after they stay home for a while. Sometimes it could be depression, right? It could be depression. or that you've just been home a lot for a very long time and you just don't know because you're not going outside. But I would encourage you to exercise your brain and also watch TV and watch the news channel. The news channel always tells you the date and always tells you the time, and it tells you the weather. Okay? Tells you the weather. So, based on my research, it says that um, Alzheimer's usually affects people that are 65 years or older. Okay. And 65 years is very young still, I want to say. Even though that's age of retirement, it's still quite young. People at 65 are very vibrant, very young. Really depends on their lifestyle. Okay. So let's talk about lifestyle for a minute. Lifestyle. Your lifestyle will really determine how you are in your older age, in your older years. So if you're someone that is not active and someone that likes to stay home a lot, you more than likely would be someone that wouldn't be wouldn't be the first person to jump up and say, I'm gonna go do an activity outside, like at a senior center. Okay. And if someone's encouraging you to go, I would say go. Go at an early age, start going at the age maybe even 55, 50. Okay, 55. I think from the age of 50, you're a senior, if I'm not mistaken, in Canada. Let me just look that up. What is considered to be a senior? What is considered to be a senior in Canada? Does anyone know? What about the countries, Caribbean countries? Considered, let's see, to be a senior. I'm looking it up. All right, let's see. 65. Okay, so early definitions of senior could be 50 or 55, as I said. So 50 or 55, you can definitely benefit from seniors activities and seniors programs. And I would encourage you to go out and start going to programs if you're not already doing that. Get yourself involved in fitness programs, get yourself involved in maybe an art program, a walking club, something that piques your interest, that keeps your mind going, right? And that's why a lot of people stay on too, and then they stay on working for a very long time because it keeps them active as well. Even though they can retire, they choose to not retire because it keeps them very active. All right, so going back to dementia. So once you find out that the individual that you're supporting or being the caregiver for is going through early signs of dementia, you want to take them to the doctor. And I said a geriatric doctor will determine this. And from there, you have to make decisions, right? Can this person live on their own? Do they live on their own? If they're living on their own, is someone going to be there to check in on them regularly, right? Because if something should to happen, like if they don't take their medication, then that could be something that will affect their health even more because they don't have the proper medication. Something like a blister pack. I don't know if you've ever heard of a blister pack to take medication. The medication can be placed into, like, it's almost like those packed gums where you pop out the gums, like a Trident or Dentine gum, and you pop out the gum. Medication will be placed in one of those blister packs for that patient to help them to remember to take these pills at this time. And usually it's laid out where it's a morning, lunch, and dinner. And it specifies that on the back of the package so they know when to take it. Now, if they're in a stage where their memory is going even more, sometimes they might need something called a dementia clock or an alarm clock. So I've purchased this a dementia clock, and the dementia clock will tell the person that it's medication time or it's 7 o'clock, time to take your meds. It will speak. Okay, so that will help you as a caregiver or supporter to support that individual when you're not around, right? But what happens when they forget why this alarm's even going on? Okay, so in my case, now the individual has forgotten why they even have the they've forgotten why they even have this dementia clock and why it's saying it's 7 o'clock, time to take your meds. They're just going through the day, not remembering. And now they're thinking that clock is just saying it's 7 o'clock to let you know it's 7 o'clock. It's an alarm clock. That's what they think it is at this point. Okay. And it gets really sometimes sad and frustrating for you to figure out how to support that individual. And what I would encourage you to do is to also seek help and support for yourself. And don't try to do it alone, right? Make sure you have the proper resources for yourself to care for that individual. Because as a caregiver, it takes a toll on you. It takes a toll on your body and your memory and your health as well. Okay, so when you're caring for individuals, you need to also make sure that you're being taken care of as well. Okay, so make sure you do your regular checkups at the doctor. Make sure you're also checking in to get the proper supports. If you need to see a therapist yourself, or get a medical professional to diagnose the proper diagnosis for the individual. Okay, maybe after they're taking this medication and the medication reminders are coming on and they're not doing it, maybe the next step would be to get an agency or an organization that will come in and do medication reminders for that individual who's suffering with Alzheimer's, right? They would call the individual and say, hello, sir, ma'am, did you take your medication at 9 o'clock? It's 7 o'clock or it's 8 o'clock. Did you take your medication? So it's just someone checking in to make sure that the individual has done what they need to do and take the medication as well, right? I had a whole thing here. That talked about how dementia, Alzheimer's affects Black and Caribbean diaspora, African and Caribbean people. Okay. I'm just going to quickly go through my phone to look for it. But if you have any questions and you want to chime in on the conversation, don't be afraid to do that. We are live on several platforms tonight. We're on Facebook TDN. We're on YouTube TDN. We're also on Twitch. And we're on Instagram. So don't be afraid. Send in your questions and I will answer them as I can. If I don't have the answer, I will say, I don't have the answer. Let me look it up. Okay. And with that, I'm not a medical professional. Okay. Just to remind you, I'm not a medical professional. I'm just speaking based on my opinion and my experience. Okay. All right. So it's here. as I was saying about Alzheimer's, that we as Black people, we are higher risk of developing Alzheimer's because of the fact that we don't often take things as serious as we should. We don't go to the doctor regularly. So we need to get those checkups. Don't be afraid to go to the doctor. Don't be afraid to get your checkups. You should be actually getting a physical done once a year with your medical practitioner. Getting a physical every year means getting blood works. Some things could come out through the blood and tell your medical professional to tell you that something's wrong, right? Some things can come out through your blood works. I'll tell you some things that I discovered about myself through blood works, just so you know. Something as rheumatoid arthritis can be discovered through the blood. Yep, I didn't know. I have RA, rheumatoid arthritis, and I'm not old. I'm not old, right? So that can be something that you may have and you don't even know, right? So don't be afraid to send in your questions as well, as we're saying. Now, in Canada, we have a lot of support networks. We have the Alzheimer's Association for people that are going through Alzheimer's. We also have some free organizations. So we have, I'm going to give you examples of things within Toronto that I know of. There's Canes Senior Services. That is a senior service that is a non-for-profit organization that supports seniors with PSW workers. They may have someone that comes in to clean for an Alzheimer's patient or dementia patient. With this, that's something else to look out for as well. So this is an early sign of memory loss as well. That person is forgetting to clean or forgetting to take things out, trash, right? I don't know if you've ever seen those hoarder shows where people are piling up things in their house. And sometimes that has to do with memory. And a lot of times it has to do with mental health. The individual is not well, they're going through depression, and they start to pile garbage up. And so that also happens with individuals who have memory loss. So they're not remembering to do these things, to make up the bed, to do the laundry, right? So having a service come in like Canes Community Service, they are a non-for-profit organization that can come in. And I'm just going to list a few. So I have a list of different organizations. There's another one called Cleaning for a Reason. Cleaning for a Reason is an organization that is based in Texas, I believe. It's based in the States, but they support in Canada. So they have agencies in Canada that do cleaning for cancer patients specifically, but they also do cleaning for individuals that need support. Okay. Somewhere that you can contact if you're thinking that your elderly parent is going through dementia is the Trillium Health Partners Geriatric Service. So Trillium Health Partners Geriatric Service is run out of Queensway. Sorry, not Queensway. It's Credit Valley Hospital, which is on the Queensway in Mississauga. And also Mississauga Valley Hospital is another place that has a geriatrics service. Okay, those are just ones that I know of, but I'm pretty sure there's a lot more. It depends on the area that you're living in. So sometimes services are available to you based on your area that you live in, right? Another big one I would say is called Ontario Health at Home. So it's home care that comes into your home, the individual's home, to do support. And you just call them. You can self-refer, but I think the best thing would be to call them, to ask questions to them about services that you need in your home, and just be very candid about it. And I would say be very explicit about what's happening with the individual so you can get the proper support. Don't just call in a willy-nilly or nonchalant kind of way. Be very, very determined and intentional when you're calling. Maybe even write a list of things so you don't forget what you want to speak to Ontario Home Care about. Okay? So tonight, if you're just chiming in, you're just tuning in, we're talking about dementia and Alzheimer's. Early signs of Alzheimer's is considered to be dementia. So dementia is not full-blown Alzheimer's. It is the early signs of progression towards Alzheimer's, right? And these are things, so I'm giving supports, so resources that can be accessed in the Toronto area. Okay. But in the Caribbean, if you're listening in the Caribbean, there are services as well through Alzheimer's associations. You can check those out in the areas that you're at. Just Google. I would say just Google Alzheimer's services or support services, and you will definitely find something in your community or area. And if you're not sure, I would say speak to the medical practitioner and your doctor or your nurse practitioner, whoever your health practitioner is, and ask them what supports are out there. That's why they work with you and your family. Okay, they're working for you. Don't be afraid to ask these questions. Okay. There's another organization called Lifeline Canada. Lifeline Canada is a personal home alarm system. So as I was telling you, there are organizations that will call and remind clients or patients that they need to take their medication when they're forgetting to take their medication, despite the fact that it's in a blister pack, right? Not despite the fact that it's already organized and set for them to take their medication. So that's Lifeline Canada, Alzheimer's Society of Toronto, and Toronto Dementia Network. That's another one that you can check out. So Toronto Dementia Network help to identify dementia. It's a friendly service for people living with cognitive impairments. Okay. And what's the other one here? So I also wanted to mention to you, that some people may not have heard of this before, that sometimes drinking a lot of alcohol could also contribute to something called alcoholics dementia. So alcoholics dementia is caused by the brain cells dying as well because of the alcohol, right? So I'm just going to look it up to give you a definition about alcoholics dementia. Alcoholics dementia. And this is, oops, sorry, I'm looking it up in the wrong space. Alcoholics dementia is something that can be temporary or can be long-term. It really depends on the individual. If they continue to contribute to it, or if they are weaning themselves off and getting treatment. Dementia. I'm just looking it up. Okay. All right. So what happens with the alcoholic's dementia is it's a alcoholic related dementia, obviously, and it means that they are having damaged brain cells because they're drinking regularly. So people may not think that. So, and that can happen to anyone, not just someone who is older, but if someone that is abusing alcohol, it can definitely play and wear down on your brain. Okay, it actually affects how you deal with things on a daily basis, right? People will have struggles with that, with daily life. Okay, what does it look like? People can experience more severe memory loss. They struggle with daily tasks, and they have difficulty communicating, right? Difficulty with communication. And they may begin to hear and see and believe things that are not real. So they may start to hallucinate. They may start to think that somebody was in their space or taken their money or has done them wrong. So almost like paranoia. It's almost like a paranoia can kick in, right? So that's with the alcoholic's dementia. But that also happens. With people with Alzheimer's. So they might think that someone has taken something from them that doesn't belong to them, or they might have taken something that belongs to someone else and think it's theirs. Okay, and so that it's kind of a slippery slope that they're heading down, where it's kind of tricky because if you're a caregiver and you're working with an individual or dealing with an individual that has dementia or Alzheimer's, they might think that you're stealing from them or have taken something from them. And you're like, no, I didn't take anything from you. And they're determined and believing in their mind that you have done them wrong. So it's important that you either record conversations or have someone else with you when you're doing caregiving. Okay. So I myself have recorded individuals when speaking with them, with the person that I'm dealing with. I have recorded conversations because, as I mentioned earlier in this conversation, in this podcast, that sometimes people may not believe you because the individual at the time is having conversation and sounds very coherent and very with it. But then there's times when they don't really present that way, and you want to capture that moment through recording it, whether it's an audio recording or a video recording. You want to have some type of evidence that people will believe you. So people will believe you, right? Because as I said, there's times when they're lucid enough to have great conversation and be very charming, and you'll see their personalities come out. But then there's times when you're like, what is this person saying? You know, they don't know the day of the week. They don't know the time of day. And so you want to record these things so you have your evidence for when you're starting, not to build a case, but when you're looking for support through agencies to make sure that that individual is well taken care of as well, right? That you get the best supports and services for that individual. Okay. So if you have any questions, you can dial the text number. You can text me at 1-647-495-3224, or you can just send a message through the platform that you're watching us on tonight, or watching me on. I said us, I'm so used to being on my other show with my partner, Navi. So you can just send a message through YouTube, Facebook, Twitch, or Instagram, and I will make sure that I answer your question. As I said to the viewers that are tuning in, I'm not a medical professional about this topic, dementia, Alzheimer's, but I have some experience, and I'm just talking about my own experience and what I've done. So just to kind of recap a little bit for those who are just coming on, I just want to let you know that you should seek medical help, from a medical professional to diagnose. If you're thinking that this person that you're working with or have been dealing with, maybe it's a family member, is losing their memory, right? They don't remember things that they said, they don't remember things that they did. And it doesn't necessarily have to be from a long time ago. It could be short-term memory. It could be like, I just told you this, and they're asking you again. Or I told you this, and you're asking me again. So repeatedly asking the same question, and you're explaining to the person over and over, that can just be definitely early signs of memory loss. So short-term memory, within seconds they forget. Okay. And so I was also mentioning getting signing for POA, so person of responsibility, helping that individual to make financial decisions, to make medical decisions. And you'll be the person to support with that, right? If you have siblings that are involved and they want to be involved, I would say include them, and also ask them if it's okay that you be the POA, or if they'd like to be POA, right? So don't try to take on all by yourself, as I said. Also, I think getting support from your family network and having a support system is most important, because if you're not well, you're not going to be well for the individual, right? So think about that. Make sure that you're taking care of yourself as well. You're getting the support that you need, whether it's from your spouse, whether it's from your immediate family, or even people at work, or a medical professional, right? Maybe a social worker, a therapist that you want to talk to about things that you're experiencing. Don't keep it to yourself, okay? Because it can be really, really rough when you are you see an individual that you've known maybe all your life, maybe a parent, right? Maybe a close family member, and now they're going through these signs of dementia, and you want to help. Don't brush it under the rug. Don't be ashamed or shy to tell people this is happening. The more you talk, the more you find out maybe people can help you, right? Maybe people can help you and steer you in the right direction. I find that our people sometimes, as I said, and I say it all the time on this show, that we need to start talking more about things that we're going through. We cannot handle these things on our own. Oftentimes, other communities tend to just put their families in long-term care, a home, and they don't want to deal with them when they become like this, right? But our people, our African and Caribbean people, we tend to take them on, our family members on, and we have them living with us. And maybe they're not living with us. Maybe we have a caretaker or a caregiver going in to see them. But then sometimes it comes to a point where you need help, right? And you need to ask for that help. If you're not going to put them into a long-term care, then you need to also seek supports, the proper supports, to make sure that the individual is well. They are well, okay? that they are taking their medication on time, that they're going to their doctor's visits and doctor's appointments, that you support with that. If you are the POA or if you are the person of responsibility. Okay? So dementia is the topic for tonight. Dementia is something that it affects our community even harder, because we sometimes wait too long to go to the doctor to get a diagnosis. And by the time we get to the doctor, the diagnosis is telling us that it's prolonged. It's already at a stage where there's no treatment. We don't want to hear that. You shouldn't want to hear anything like that. So I would encourage you to go and seek medical help, medical profession, and get it diagnosed in the right way, and ask questions. Find out what services and supports you need. Okay? Don't take it on yourself. As I said throughout the show many times, don't take it on by yourself. Okay? Just to recap as well, there are certain medications that can be taken to help individuals that have dementia or Alzheimer's. Medications that can be helped can help the memory to be stay a little bit longer. And then there's foods that can be eaten as well. Let me see if I can grab a quick list of foods that can be eaten. I know for sure, like dark fruits and vegetables, like blueberries, are really great for memory. Let me just see here. I'm going to tell you a list of foods. Foods that help memory. Prevent memory. So foods that help prevent memory are leafy greens and vegetables. That's what I was saying. Berries, so leafy greens and vegetables. Let me talk about that. So spinach, kale, broccoli, things that are green, things that are high in vitamin E. Okay. Berries, blueberries, strawberries, blackberries. Okay. They contain something called flavonoids, which are linked to lower the rate of cognitive decline. Fatty fish like salmon, mackerel, sardines, they provide something called omega-3 fatty acids, which help to reduce plaque in our brain. Nuts and seeds like walnuts, almonds, flaxseed, or in the islands we would call it linseed, right? They offer fats and vitamin E. Olives are great for you. It's a key component of a Mediterranean diet, but we could also include it in ours as a Caribbean and African diasporic people. We can include it in ours, okay? So it provides healthy fats. Whole grains like oats, quinoa, brown rice, they provide fiber and vitamin B, okay? Things like beans and legumes, beans, lentils, chickpeas are recommended for brain health as well. Okay. I just want to tell you things to also limit. And not because you're not old, it doesn't mean that you shouldn't start eating like this. You need to start now before you get older. Don't wait till you get older to start having a better diet to maintain your brain and memory, okay? Memory health or brain health. Foods to limit are processed foods, sugary treats and pastries, red meat, food that have a high fat high fat diet, and key tips: eat the rainbow. Eat the rainbow to ensure a high intake of antioxidants. So you want strawberries are red, blueberries are blue, green leafy greens, so that's green, blue, green, brown. So the oatmeal and the wheat, you want those things. Quinoa, right? We don't like to really eat, sometimes in the Caribbean, we don't like brown rice because we want to have white rice, right? So we need to like shift our diet somehow and include these things in our diet that will help us to maintain our brain health. Okay, so tonight it was really about just introducing the topic of Alzheimer's and brain health. Stay on tonight. Right after this show is This Week in Interview with Anthony Drago. I want to say thank you very much for tuning in on all the platforms that you tuned in to Minds in Motion. Tonight we talked about Alzheimer's and dementia. On Minds in Motion, you're always going to get straight talk about real strategies, real talk, and real situations. I want to say thank you again for tuning in. Tune in next week for another topic of discussion. Tuning out, it's Jewel. Thank you for tuning in.
I'm talking Joe podcast, Minds in Motion. Talk about relationships, help your emotions, behavior management when your kids start to losing it. Talk about life and all the confusion.